TDMR Europe is the industry body that is responsible for ensuring a level playing field with respect to legislation for all distributors and manufacturers of formula diet products. Total diet replacements are programs which are entirely made up of formula food products, which then are used to enable people to achieve weight losses which are usually greater than can be achieved by conventional diet. They have to be formula products because if you try to reduce the energy intake to the same extent using conventional foods, it is then very difficult to achieve nutritional balance. And so by using formula products, we achieve both weight loss and nutritional balance in the intake. Meal replacement products are formula products which are designed to provide about 1/3 of the micronutrients, but the intention is to use them to replace 1 meal per day or sometimes 2 meals per day to achieve weight loss, but more commonly to achieve weight maintenance. And there is very good experimental evidence that they can help people to maintain weight. TDMR Europe organised the seminar in Dublin because we're very clear that there is a need to educate individuals about the potential use of TDMR to resolve the problem of obesity and obesity-related comorbidities across Europe. Everybody knows that the healthcare costs and other related costs consequent to the fact that people are becoming heavier are rising dramatically. No healthcare provider throughout Europe is going to be able to cope with the increased costs related to, for example, the rising prevalence of diabetes or the rising prevalence of osteoarthritis. Something has to be done about that, and one of the ways in which we could help would be to have effective weight loss with total diet replacement. TDRs and MRPs are safe. In all of the clinical trials, the evidence relating to the adverse events is fully published, so we have a complete safety profile. And now healthcare practitioners and others have no anxieties about the use of this type of approach. Total diet replacement products and meal replacement products are nutritionally complete. The micronutrients present are in bioavailable form, and this means that they are well absorbed. And we have to bear in mind that individuals who are heavy are sometimes malnourished. And we have some evidence that losing weight with total diet replacement or with meal replacement products actually improves their nutritional status. Total diet replacements differ from conventional diets because they result in a greater deficit between the amount of energy needed by the body and the amount you deliver in the diet. Typical weight losses on a total diet replacement are in the range 1 to 2 kilograms per week. For men, we know that from the clinical trials published, the average weight loss is around about 1.5 kilograms per week, and for women, the average weight loss is around 1.3 kilograms per week. When somebody loses weight with a total diet replacement, the rate of weight loss is rapid. It's usually over 1 kilogram per week, typically 1.3 kilograms per week for a woman and 1.5 kilograms per week for a man. That means that at the end of 8 or 10 weeks, they may well have lost 10 kilograms or maybe 12. And people have in the past been concerned that they would then rapidly regain weight. Now, while that is certainly possible, we now know that this doesn't happen. There may be some slight weight regain, but we have long-term evidence for 3 or 4 years now showing that some people can maintain about 80% of the weight lost. Others do regain a little more. But this old idea that rapid weight loss is always followed by rapid weight regain is not supported by the evidence that we have now. Healthcare professionals should now consider using total diet replacement as one of the options to be considered for their patients because it is safe, it is effective, it delivers good healthcare benefits in terms of, for example, reduction of blood pressure, improvement in diabetes, improvement in obstructive sleep apnea, reduction of pain in osteoarthritis. The evidence is very clear. This is a very effective intervention. It is safe. It is cost effective. There's published evidence for that. Therefore, healthcare practitioners should be considering using total diet replacement. The reason why people are not at the present time using total diet replacements is that until very recently the evidence base has not been strong enough, but it is now strong in relation to diabetes remission, in relation to obstructive sleep apnea, in relation to osteoarthritis, and as a consequence the evidence now is such that people can begin to consider to use total diet replacement. Industry is currently facing challenges in two areas. One is in relation to encouraging people to use total diet replacements, and the way to correct that problem is to educate healthcare professionals and others, but also to ensure that there is information in guidelines. The industry is actually also challenged by proposed compositional changes, and it is very clear that unfortunately the guidance given in 2015, a little bit out of date, needs to be revised, and I think it is highly likely that we will be asking them to consider a revision of the guidelines in relation to proposed compositional changes. My view in relation to the progress that will be made with respect to the use of total diet replacements and meal replacement products in the next 5 years is based on the fact that there will be another round of publications over the next year or so that the case for actually using total diet replacements will be very strong indeed. We're also seeing some inclusion in guidelines. We also see that the number of people, healthcare practitioners and others, who know about TDRs has increased. This increase will continue over the next 5 years. My prediction is that by 5 years' time, the use of total diet replacements will be a standard part of practice in primary healthcare, in specialist practices, but also will be considered in the public health context for trying to achieve, for example, reduction of risk of developing diabetes.